Whereas children are the future, and by investing in them today, we are ensuring our world for tomorrow.
The role of the school nurse is significant because the health of a student primarily determines how that child is going to do in the school setting. So the school nurse works very closely with students to make sure that they are healthy when they're at school. And that might mean seeing them in the health office, listening to some of the issues that they might have, whether it's an acute illness or a chronic illness. If they have a chronic illness, we have to have an individualized health plan for that individual student, and we work very closely to follow that plan to make sure that the student is maximizing his or her potential in the school setting. We do a lot of screening also. We check hearing, we check vision, we check dental. And primarily, the important role of doing some of these things is to make sure that the student can hear and see well, because if they cannot, then it's really hard and very difficult for them to learn. In addition, we want to make sure that students have a medical home. That is so important because doctors, if they're involved with a student, then if that child has a problem, a health problem, then they can identify that problem and then they can share that with the school. Once the school knows, then we work together collaboratively to make sure that the child is adapted well in the school setting.
Whereas all students have a right to have their health needs safely met while in the school setting.
As school nurses, we know that the health problems facing this generation are mostly a result of the lifestyles that we live. In order to live healthier lives, we need to make healthier choices on a daily basis. We have created a series of health tips presented in the form of table toppers in our school cafeteria. Each week, students are given new information with new choices that they can hopefully make to make healthier decisions from a wide range of topics, from their diet, their choice in fast food, their sleep habits, their diet drinks, their sports drinks, daily activities, a wide range of topics. Hopefully they will take this to heart and be healthier adults because of it.
Whereas children today face more complex and life-threatening health problems requiring care in school.
School nursing is not just about Band-Aids. It's also about program implementation. And here at Leffler Middle School, we have implemented grab-and-go breakfasts to meet the needs of our students. We found that over 2,000 students visited my health office because they were hungry in the morning. That's over 500 hours of lost classroom time. We know that students who eat breakfast in the morning focus better, score better on tests, have better behavior, and have better attendance. So to meet those needs, we implemented the grab-and-go breakfasts. We've now increased our breakfast consumption from over 94 students to begin with to now 200 students eating daily. To do this, we had to collaborate and write grants and look at research and look at literature review and do just good old-fashioned program implementation. And that's what a nurse can do for you at the school level.
Whereas school nurses are members of school-based mental health teams.
As a school nurse, I'm a member of a school-based mental health team. The top 5 health problems of children in the United States are now mental health problems, not physical problems. Approximately 1 in 5 children and adolescents has a diagnosable mental health disorder in the course of a year. In the past 10 years, we've seen a dramatic increase in the number of students needing support in this area. Our role expands beyond the school community as we collaborate and refer our students to mental health professionals and resources in our greater community.
Whereas school nurses are professional nurses that advance the well-being, academic success, and lifelong achievements of all students by serving on the front lines and providing a critical safety net for our nation's most fragile children.
School nursing is more than just Band-Aids and ice packs. School nurses are professional nurses that advance the well-being of our students. We not only take care of minor illnesses and injuries at school, but we also partner with our families and community physicians to take care of our most complex medical needs at school. We have many students in our schools that require treatments and have complex medical needs, illnesses, things like diabetes, students that require tube feedings, or we also have some students with tracheostomies at school.
Whereas, school nurses act as a liaison to the school community, parents, and healthcare providers on behalf of children's health by promoting wellness and improving health outcomes for our nation's children.
School nurses are truly the voice that connects our students and their families to health care in the community. It's our role as school nurses to ensure that our students have access to health care and know about means of acquiring health care here in the community to promote health and wellness for our families and our students in the school system.
Therefore, May 7th, 2014 is proclaimed as School Nurse Day in the state of Nebraska.